So the overall project started at the University of Pittsburgh because of the need of digital dentistry outside in the workforce, which has only been about maybe 10 to 20% of the private practices. So we took that into the university and decided that we needed to teach that to the students. So what we did, we tried to design 3 different labs. We have a pre-clinic lab, which is where students, first and second years come in, who are still developing their techniques and so forth. And this is the lab that we're in now. And we made a 3rd floor lab, which is designed for the pre-docs. So basically a lab that was created to have patient data and crowns created in there. The 2nd floor lab is the same type of lab, more designed with better software and so forth for residents.
Our plan with all these labs has been that the students and faculty have access to all these softwares, all these materials anytime they want, so that they can practice as much as they want and become proficient in it.
So instead of just explain to students, they can see from the monitor where we are pointing out where to adjust. Also, patients can see what's going on in their oral health.
The main goal is to teach our students digital dentistry, from scanning to designing to printing models to manufacturing crowns, and that is our goal, is to teach the students from the very beginning of the process to the end of the process.
It's very exciting for the future to teach students how to take care of patients better.
Hi everybody, I'm Renee Paichaki, the art consultant who's been working on the new Kamin Tower at UPMC Presbyterian. As you've been watching the building come into construction, you've probably been noticing some very colorful bits. And you might be thinking, is that art? And I'm here to tell you that you are right, it is art. I started on the project in 2022, thinking about how can we make this a caring space for patients and families, a dynamic space for communities, and a positive space for staff. We're here in one of the projects in the Spirituality Center, which is a glass project by an artist named Nori Sato, which, looking that way, will eventually have a mosaic that goes on the other side.
I got selected after competing to do this particular project, and this was a collaboration of making this space have a kind of different quality from above and within. I really wanted to bring the idea of plants into this setting. So we of course have the landscape here, but it's nice to have this completely different scale of leaves crossing through the site, and then these kind of miniature postage stamps of medicinal plants that are cast into glass. And these are basically the exact same configuration as the pavers, so you can just slot these in where they can be. The fact that this hospital is both people who are having cups of coffee as they're passing through to get to their classes, but also for nurses who have just had a really tough time, and this gives them a place to come out and think about being connected to nature, and maybe that's going to be healing for them too. I don't want you to have to go to the art, I want the art to be there when you need it. So working in a space like this is really meaningful for me.
Today we're having a very special event to really celebrate and acknowledge the fact that here at UPMC Washington Hospital, we have our UPMC Magee Womens signature services right here in the community.
Long before we officially became UPMC, we were excited to join UPMC and everything that would bring with it. But part of that promise was bringing UPMC signature service lines to Washington and Greene County. And this is just fulfilling part of that promise.
UPMC is committed to investing locally in our facilities, in our innovation, and in our people. Just over a year ago, UPMC announced that it will invest over $300 million over the next 10 years to enhance services and upgrade UPMC Washington and UPMC Greene hospitals. And today, we're proud to announce UPMC Magee Womens at UPMC Washington.
If you think about it, if we didn't have this labor and delivery unit here in Washington County, women would have to travel into the city. As our community expands and grows, and it is, having that care for young families is critically important for those folks.
We're really thrilled to offer a lot of signature services today, and we really hope to expand those services as we continue to grow with the community and respond to the needs of the community.
Well, it's an exciting week because we are graduating over 300 graduates across all 7 of our UPMC Schools of Nursing. Well, they're significant because currently they address the nursing shortage nationwide, exclusive to Pennsylvania.
Our UPMC Schools of Nursing are so unique due to our diverse population of students. We have excellent nursing faculty who prepare our students to be graduate nurses in a variety of settings in our UPMC facilities.
We're graduating nurses who stay in our rural and urban communities and benefits to our patients and create more access to care.
I'm so excited to start this new career path and just really be a helper to people.
I've always had a passion for helping others and being in the healthcare field, so I figured I'd try nursing.
Patients. I am a student nurse that likes to actually sit, get to know them, and have compassion. I'm very patient.
Nationwide, wherever you go, everyone's always in need of caring, everyone's always in need of good quality care, and I'm very confident that all of our classmates can provide that care and lead that change.
UPMC is a great company to grow and to learn more.
Just making sure that there's continuing education opportunities, support, because even once you get out of that beginning nurse stage, it is always important to have a supportive unit director and supportive coworkers.
I saw how integral the nurses are to the care of our patients and the voice that they had within the organization.
I will be working at Community Osteopathic after this.
UPMC Williamsport in the emergency department.
UPMC Mercy on the spinal cord injury unit.
UPMC Shadyside on 3 Main, which is the cardiothoracic step-down unit.
And Harrisburg Hospital on Main 5
in the CTICU.
I'm going to be in Jameson's emergency room.
It fills my cup to see all these new, energized nurses, and they're staying in our region, which is so exciting and going to give great quality care to our patients and our communities.